A Guide to Successfully Managing Cataract and Post-Op Cataract Patients by Jesse Atkinson. Cataract definition. A cataract is a clouding or loss of transparency of the lens in the eye as a result of tissue and protein breakdown. Cataracts are the most common cause of vision loss in people over the age of 40. Why does a cataract cause vision problems? When the lens is clear and the patient is fully corrected, the cornea and crystalline lens work together to bend light, which perfectly hits the macula, allowing the patient to see clearly. When a patient has a cataract, light that enters the lens is diffracted, producing scattered light that does not perfectly hit the macula and leads to blurry vision. On the next slide, as you can see to the image on the left, that this is a normal lens. The light comes in and is perfectly directed back to the macula. In the picture on the right, with the clouded lens from a cataract, you can see the light comes in, but as it hits the lens, light is scattered and does not perfectly hit the macula, causing blurry vision. Cataract symptoms. Common symptoms that you may hear your patients say are glare at night or halos around lights while driving, decreased contrast sensitivity, and an example would be needing extra light to read, and blurry distance or near vision. Why do patients see colors more vividly after cataract surgery? Due to the breakdown of protein and tissue in the lens, you get a yellowish color of the lens, and what happens is when light comes in, it absorbs all colors of light, but especially blue, and the main color that gets transmitted back to the eye is yellow. That takes away some of the patient's color perception and produces more of a hazy yellowish image for the patient. What causes cataracts? Of course, the most common is age. That can be to UV light and just typical wear and tear of the lens and chemistry of the lens. But there's also trauma, radiation, genetics, smoking, diseases. One we especially think about is diabetes. Medications, main one in optometry that we like to think about are the oral and topical steroids, and it can also be due to congenital or a patient was born with the cataract. Types of cataracts. There are multiple types of cataracts the patient can present with, and each can change vision in different ways. What determines the type is where the lens is clouding and how the lens is affected by the clouding or breakdown in protein and tissue. So on this slide here, this shows the different types of cataracts and where in the lens the cataracts can affect. If you think of your cornea on the left and your retina on the right, you can see in the middle here the nuclear cataract, which is the most common, cortical as it presents in the cortex of the lens, and then you also have the anterior and posterior cataracts. Prior to cataract surgery, there are many things needed to discuss with the patient. The length of surgery. Cataract surgery is very fast, taking no longer than an hour. However, the patient should plan to be there for a few hours at the surgery center. They'll have to fill out paperwork, be dilated prior to surgery, take medications in order to relax and anesthetize the patient. The patient will have to have the face sterilized because it is surgery. We don't want any bacteria to get in, and multiple other steps needed to take before the patient will even see the doctor before surgery. Worst eye first. During cataract surgery, it is very common to have one eye done at a time. We do not like to do two eyes at the same time, just in case there was a complication with the eye. It is much better to lose vision in one eye than both eyes. Light sensitivity. The patient will be very light sensitive after surgery. The patient's dilated in the operated eye in order for the doctor to have the best window back to the lens. And also, there's a new lens in the eye. Before, the clouding was blocking some of that sunlight, and now light can fully get back to the retina. Medications post-surgery. There are multiple medications that a patient could be prescribed, and they'll vary depending on the surgeon. But generally, there are three categories of medications that a patient potentially could be on. There's steroids, which are a pink or white cap, that prevents inflammation. NSAIDs, which is a gray cap, it prevents inflammation and also helps with ocular pain. And then an antibiotic, which prevents bacterial infections. Medications that are contraindicated, blood thinners such as aspirin, warfarin. Reasons for that is that this is a surgery. We do not want any blood to get back into the eye or cause any extra damage to the eye. Miotics, which constricts the pupil, that mostly we think about is pilocarpine, and we need that pupil to be dilated in order for the doctor to get a large window to look at that cataract and extract. If a patient is a glaucoma patient, they may be on a prostaglandin. He or she is not allowed to go on the prostaglandin during surgery, as prostaglandins cause inflammation. There are different types of lenses that a patient can have implanted in their eye. One on the left is just the single vision, which can be a sphere or also a toric lens. And on the right is a multifocal lens, which has both rings for center and near distances. So an IOL example, if a 63-year-old male received a single vision IOL to correct his distance prescription, and he does not have any other ocular complications, he will only need to wear reading glasses up close and will not need any glasses for distance. The multifocal IOLs are a work in progress. If a patient chooses to have a multifocal IOL, they will be able to see a range at both distance and near, but they have lost the crispness of their vision, both at these distances, sacrificing clarity for range of vision. What to expect on a 1-day, 1-week, and 1-month follow-up. Day 1 post-op. It is not unusual for the patient to complain of an itchy or scratchy feeling in the operated eye. The patient did have surgery, and they did have to cut into the cornea, which is one of the most sensitive parts of our body. So they'll complain it'll be on the temporal side of their eye. And it is okay if the patient's not 20/20 on the first visit. The cornea may still be a little bit swollen after cataract surgery. At a 1-week post-op, most patients should be 20/20 to 20/25 by this time, unless other ocular diseases are involved, and the feeling of the itchy and scratchiness will begin to resolve. At a 1-month follow-up, corneal swelling should have decreased and vision should be to 20/20 as long as other complications are not noted. If the patient has Medicare, a new pair of glasses can be prescribed at this time. And also, a patient should be dilated at this exam or an optos picture taken, as it is common to begin to see the signs of cystoid macular edema at these visits. Complications post-cataract surgery: cystoid macular edema, which is inflammation of the macula causing metamorphopsia. Trying an Amsler grid during prelim testing is a great way to test for this. Retinal detachment can occur months to years after surgery. Cataract surgery on the eye does cause a lot of energy to the eye, and of course causes a little bit of trauma. So retinal attachments can occur, especially if there are weak spots in the macula. Infection, the major one we think of is endophthalmitis, that can occur within 6 weeks after surgery, and the patient will report pain. Choroidal hemorrhaging is much more common in the elderly, and you get choroidal hemorrhaging for much of the same reason as retinal detachments. Posterior capsular opacification, this is the most common. It happens in about 30% of post-cataract patients, and patients will complain of haziness, almost looking like a second cataract that occurs after surgery. And what a PCO is, it's the scarring or extra epithelial growth that happens on the posterior capsule of the lens. And the posterior capsule of the lens we keep in order that the new lens can fit in there. And when that epithelial growth begins to grow, it can cause a haziness and start to block and scatter the light just like a cataract did. PCOs are easy to treat as well. You can use a treatment called a YAG laser, and with that YAG laser, it only takes about 15 seconds for each eye, and it kind of zaps the epithelial cells and they cannot regrow back on, and then the patient will not need any farther treatment. A dislocated IOL, the patient may report double vision. So just a recap of what we learned today: vision after cataract surgery, for single vision IOLs and no ocular complications, the patient should be seeing well at distance as they would with a clear lens in their eye, and will only need reading glasses. For multifocal IOLs, do not expect the 20/20 vision at distance or near, as the patient has to compromise a little bit of both distances in order to get that range of viewing. There are 3 types of ocular medications a patient may be on during after cataract surgery: an antibiotic, a steroid, or an NSAID. Prostaglandins are contraindicated after cataract surgery until given an okay by the doctor. And there are usually 3 follow-ups: a 1-day, 1 week, and 1 month. At the 1 month, the patient is to be dilated or an optos and can be prescribed a new RX if needed. Thank you very much.